All right, guys, I want to welcome you to Joint Health. This is one of my most favorite classes because so many people don't realize that we need to be taking care of our joints at an early age. You know, the number one cause of disability in this country is joint pain and arthritis. So we're going to talk a lot today about how we can prevent arthritis and how we can treat our joints kindly so they'll last us a lifetime, because once your joints go, then you're getting immobile, you can't exercise, and you go downhill fast. So we've got to keep our joints healthy for our entire life so that we can continue to exercise and be mobile and just be able to move freely. So one of the first things that we know about joint health is that most people get confused and they think that arthritis is not for them, it's only for their grandparents. But unfortunately, arthritis starts 30 years before you can actually see some of it on x-rays. And so you have to start taking care of your joints early in life. And arthritis is basically a big word that means inflammation of the joint. And there's multiple different types of arthritis, rheumatoid, and the list just goes, there's over 100. But what most people talk about when we talk about arthritis, the most common term is osteoarthritis. And osteoarthritis means your joint has deteriorated enough to create degeneration as well as arthritis or bone spurs in the joint. And if we don't do anything about it, the joint completely wears out, and then we end up having to get the joint replaced. So we don't want arthritis because it really deteriorates our ability to move. And you know, traditionally, what we do is just drugs, shots, and surgery, and that doesn't work. So we have to hit this thing early. And on the chart there, you see the phase 1 spinal subluxation degeneration model. That for a joint be out of alignment for about 5 years, it will show up on an x-ray as being out of alignment. But once it's been out of alignment about 10 years, then you'll see they're showing signs of degeneration. Now, you can see a phase 2 sometimes as early as 5 years if you're very active. So the more active you are while you're out of alignment, the faster the joint's going to wear out. So for example, if you're a marathon runner, if you're a heavy exercise person, and you're doing triathlons and things like that, it's very important that you get your joints checked routinely so we don't develop degeneration and eventually arthritis. So once you've been out of alignment about 20 years, you then will definitely have arthritis on your joints. You'll have severe degenerative disc disease, and you can see that phase 3 picture there. Now, many times people come in our office and they're phase 3, a lot of times in their neck, and they tell me they've never had neck pain. So this is a wonderful reason why we should always get our joints assessed. Minimum, everybody should have their joints assessed a minimum of once a year. That means head to toe, your ankle, your foot, your knee, your hip, your shoulder, your elbow, your wrist, your spine. All your joints should be assessed a minimum once a year, so we prevent these things from happening. Because what happens is people come in here with phase 3s and never had pain before. And why is that? Well, you didn't compress 90% of the nerve, or you adapted. The most common thing we adapt with is poor posture. And you see these people with very bad posture. It didn't start overnight. It started in their 20s. They didn't do anything about it because they didn't have any pain, and it just kept getting worse and worse. And now they're into a phase 3 severe degenerative disc disease. And remember, we can fix phase 1s and phase 2s, but once you get into phase 3 degeneration, you're going to have that arthritis the rest of your life, and you will need weekly chiropractic visits just so you can have an optimally functioning spine and nervous system to keep the pressure off the nerves. And then once you get into stage 4, we're not the people for you. Phase 4, we send them off to the surgeon, and then once they've gone through the surgical rehab and all that stuff, then they come back here. And those phase 4s, to prevent the second and third surgery, they're lifetime patients for the rest of their life. So it's a lot easier, it's a lot cheaper to fix phase 1 and phase 2. And that's where we want to encourage everybody to stay well away from phase 3, where you actually see the arthritis on the joint itself, and it shows up on the x-ray. So remember, traditional treatment always does the same thing. You go to the doctor for any problem in your joints, and he always does first drugs, then he does shots, and then he does surgery. And the most classic example I can give you is you go into the doctor with knee pain. And remember, we know that 80% of orthopedic research shows that knee pain starts as either a foot problem or a back problem. He doesn't even look at your back or your foot. He only looks at the knee. He orders the MRI, and then he comes back and says, okay, you're going to take the Celebrex. Years ago, it used to be Vioxx, and Vioxx, they took it off the market because it caused heart attack and killed thousands of people. And these drugs have serious side effects. But now they're prescribing Celebrex. And if the Celebrex works, you will take the Celebrex for the rest of your life, not mentioning the side effects, which are devastating to your overall health. All right? And then if the Celebrex or the over-the-counter medications does not work, your next step he's going to do for you when you go back and you still have pain, the next thing the doctor is going to do for you is he is then going to prescribe a corticosteroid injection into your knee. And that will typically last 3 to 4 months. And you're going to feel so much better. You're going to go out and use that joint. And once you use the joint, you're going to make it worse. You're not knowing you're making it worse because you didn't feel it. Because the corticosteroid injection actually numbs up the pain. And the worst thing it does is it accelerates the degenerative process. So it destroys the cartilage in your knee. And they prescribe these still today. Here it is, almost 2020. And they're still doing these injections into the knee that do nothing but make the joint worse in the long run. And then once you have pain after the injection wears off in about 4 months, you go back to your doctor and he always does the next thing. Well, let's go ahead and do some orthoscopic surgery. And that typically lasts about a year. You go back to the doctor with more knee pain, and then he says, well, we're going to have to replace your knee. It's sad because now there's nothing left of the cartilage. You've totally destroyed the cartilage because you used the joint when you're out of alignment. You didn't know you were out of alignment because you didn't have any pain, and now it's bone on bone. Think about your car. Your front end's out of alignment, and you keep wearing the tires out. And all you're doing is replacing tires, replacing tires. You have to correct the alignment of the joint for it to regenerate on its own so you don't get to the point where you just got. And what's so sad is that everybody believes the fallacy that arthritis is a normal part of aging. No, arthritis only comes about because you're out of alignment and you're active. And the more active you are while you're out of alignment, the faster you wear the joints out. Just like hammering that crooked nail. If it's a little bit crooked and you keep hammering it, it's just going to get more crooked. And that's how we take care of our bodies, unfortunately. So that's why this class is so important. You guys are going to learn a ton here. And then the other thing that we do is we take the non-steroidal anti-inflammatories like Advil and Tylenol, and guess what? You're going to have to take them the rest of your life. And then they're going to destroy your liver, destroy your kidneys, and you're going to have on your death certificate, it's going to say kidney or liver failure. It's not going to say overdose of Tylenol or Advil, right? But that's the world we live in today. So we have to be very careful, take care of our joints. And then look at this study on Lyrica. Lyrica, one of the most commonly prescribed medications for sciatica, which is pain down the leg and joint pain, okay? And the sad thing is the side effects of the Lyrica is awful for you, but it didn't do any better than the placebo. And yet we still prescribe this medication today for joint pain and sciatica pain, which is pain down the leg. So what we don't want to do is mask symptoms with drugs, especially drugs where the side effects are worse than the benefit, okay? So what do? We start with what we call the 5 steps preventing joint pain and arthritis. Number 1 is we want to maintain orthokinematic and joint alignment. Orthokinematic means make sure the joint has normal range of motion. So that means you need to let us check your joints minimum once a year so that they all stay in alignment and we don't end up with problems down the road. So remember, subluxation was basically the misalignment of the spinal joint. A fixation or malaligned joints, those are joints in your extremities. That could be your foot, could be your knee, ankle, anywhere in your body. Your joints have to be moving properly. So we have to make sure we maintain alignment, okay? And so we call it orthokinematics, maintain joint alignment. And if you don't have good joint alignment, you're going to cause other problems down the road. So if let's say your foot's out of alignment, well, that can create a knee problem, it can create a hip problem. Because remember, your foot's your primary shock absorber. There's only 26 bones in the foot and 27 different articulations. So it's very important that we keep everything in alignment from head to toe. Remember, our old motto was, any pain, head to toe, Team Cairo is the place to go. Why? Because you go anywhere else, all they're going to be doing is wasting your time and money treating the symptoms. You'll feel better temporarily, but you'll actually make the real problem worse. So any problem head to toe, always we're the place to go. Now, stretching. Make sure that we have optimal stretch. We need to stretch our joints, every one of our joints, every day. So one of the first things we do is you wake up in the morning and we do the nitro workout. The nitro workout gets the blood flowing in our body. It helps us move, and it increases our range of motion. So the worst thing we can do for a joint, just like the worst thing you can do for your car, is have it sit in the garage. Our joints need to move. Now, if your joint's out of alignment, that's not the time to move because you're going to make it worse. But we need to take our joints to normal range of motion. So, for example, when I'm in the shower, I will wash my back with my all the way back here. And I'll scrub all the way back here, and then I'll come all the way back here, all the way back here. So I'm making sure I'm taking my shoulder through the full range of motion. I will scrub my feet with where my legs are straight, so that I can stretch my hamstrings and my knees while I'm in there, right? And so you're taking your body through the full range of motion every day. And the exercises we give you, the hyperextension exercises, the nitro, rotation of your head, you want to take all your joints through the normal ranges of motion. And what you're doing is you're making sure that you have normal range. And once you get a joint that's a little stiff, hey, doc, take a look at this joint. It doesn't have as much range of motion as this other joint. So you're comparing your wrist, your elbow, your finger. You're comparing all your joints to each other. So for example, let me just talk about how important this is. So a normal range of motion, this is what we call active range of motion. Everybody see my finger? Active range of motion, okay? The passive range of motion is at the end of that, and between here and here is what we call passive range of motion. At the very end of that is called the periphysiological joint capsule space. And that's the part where you make an adjustment, you enter the periphysiological joint capsule space. So to adjust you, I have to make sure I've cleared out all the active and passive range of motion. So just by getting adjustments alone, you're increasing your range of motion of your joints in your body. So adjustments are something you're going to want to do the rest of your life, okay? Then you're going to want to make sure you find any joint that's a little stiff feeling and you let us know about it, because it's only going to get worse if you ignore it. And it's definitely not stiff because you're deficient of Tylenol or Advil, right? So we always want to make sure that we always check our joint range of motion for every one of our joints. And it's something we're going to do individually for the rest of our life, okay? Now exercise, remember the big thing on exercise, this is step 3. We do not exercise a joint that's out of alignment. That's just going to hammer the crooked nail, right? So before we do any kind of high impact exercise, always get your joints checked. If it's low impact, like swimming, cycling, elliptical, not that important. But when you're going to do any kind of high impact, running, jumping, any kind of golf, any kind of high impact exercise, you're going to want to make sure that you get your joints checked. And exercise is good for all of your joints. Keeps the joints moving, keeps them strong. So always make sure that you have good alignment when you do your exercises. And when you're in alignment, high impact is actually good for your joints. But the negative of high impact is it does compress the cartilage a little bit. So you never want to do high impact exercise 2 days in a row. So that means you wouldn't want to play tennis 2 days in a row. You wouldn't want to run 2 days in a row. You wouldn't want to walk or power walk 2 days in a row. You can stroll for 2 days in a row, but you can't do a power walk 2 days in a row. Okay, so high impact exercise, never do those 2 days in a row because that can lead to a problem down the road. My favorite way of doing low intensity exercise is on what we call high intensity interval training. So get on the treadmills or the elliptical. My elliptical is probably my favorite. You can do the pool, bicycle, whatever you choose. And basically what you're doing is you're doing intervals where you're going up to your maximum heart rate and then you come back down, back up. And the high intensity workout is on the advanced exercise class, which is now online. I encourage you guys to all watch that class as well. Part of the exercise class, we're teaching high intensity interval. So we'll go more into it in that class. But this is a great way to keep your heart strong as well as you protect your joints, because you're doing the high intensity interval training without damage to your other joints. And you can do low impact exercise every day. You can't do high intensity intervals every day because it's too much on your heart, but at least 2 to 3 times a week, okay? Also, we want to step 4 is we want to avoid foods that cause joint decay and inflammation. The worst thing you can put in your body is acidic foods. There is no beverage or food you can put in your body worse than a diet soda pop. It is the most acidic food. It has a pH of around 2. It's got a chemical called phosphoric acid in it, which destroys your cartilage, causes more inflammation than any other thing you can put in your body. So you want to avoid any kind of soda pop. Way too acidic. You want to make sure your diet is full of God's food. Natural foods are anti-inflammatory foods. The processed foods, the sugary foods, the trans fat fried foods, they're all acidic and they destroy our joints because they create more inflammation to the joint. Also, when you're eating healthy, you're feeding your joints, and you want to make sure that your pH is high. You want an alkaline pH, you do not want an acidic pH. And you want to make sure that you're getting the right supplements for your joints, okay? And we'll talk about this a little bit later, but you want to have good omega-3. When you have a lot of joint pain, you want at least 1,500 or we all should have 1,500 milligrams of omega-3 per day. And we should also have a good joint supplement, which we'll talk about a little bit later, okay? But remember this, sugar and processed foods, soda pops, orange juice is very sugary, so it's very acidic, very bad for our joints, okay? If God made the food, it's the food that will feed your joints. If man processed the food, so the orange is good for you, but the orange juice is bad for you, right? So because man has processed it. And if he processes it, he takes away God's natural nutrients, and then you end up with inflammation. When you eat God's foods, they're naturally anti-inflammatory foods, so they're naturally feeding your joints, okay? So stay away. You know, the big thing is people want to drink a little glass of alcohol at night. The problem with that is it spikes up your blood sugar level, and that increases inflammation. And then people say, well, it helps me sleep. But yeah, but the other end of it is you're not getting to deep sleep. And remember, 1 drink turns into 2 drinks, and then 2 drinks turns into 3 drinks. So we want to avoid alcohol for our joints, as really for our overall health. We don't want to consume alcohol because that's a version of man's processed food. So we talked about feeding our joints, the anti-inflammatory diet. And if you look at this picture of the joint here that I'm showing you, I want you to see that the joint has what we call the ligament on the outside. The cartilage is basically the disc in between the bone and the bone. And that has to be protected. And it's called the synovial fluid sac, which gives your joints the cushion. The cartilage helps you absorb shock. So the thicker your joints are, the healthier your joints are. The more, when they start getting out of alignment, then they degenerate, they get thinner. And then the next step is the body recognizes that thin joint as a weak joint and tries to stabilize that joint with arthritis. So remember, arthritis is nothing more than a compensation from the misalignment. So we always want to make sure that we keep healthy joints and that we keep our joints moving so that we can have proper mobility as we get older. One of the best supplements, I talked about this earlier, but one of my favorite supplements for your joints is omega-3. 3,000 milligrams per day of omega-3 if you have joint pain. If you don't have joint pain and you're just trying to maintain healthy joints, you just want 2,000 milligrams per day. If you are acute and you have some kind of new injury, okay, then you want to add a supplement called Ligaplex 1. It gives your joints natural anti-inflammatory properties and helps you get over the pain part. If you're having trouble sleeping because of your joint pain, then we recommend Formula 303, which is a natural homeopathic vitamin to help relax the muscles and help you sleep a little bit better. But overall, the joint complex is by far my favorite joint supplement, okay? Everyone should take at least 1 joint complex a day on top of their 3,000 or 2,000 units of omega-3. So omega-3, we're all deficient of that. We need that the rest of our life. We bump it up to 3,000, we have joint pain. But to prevent joint problems, we take 2,000 a day. And to also prevent joint problems with the joint complex, we just take 1 a day of those. And the joint complex has all the things that I love for your joint. And we used to take these things individually, it'd be over $400 a month. Now, it's like $40 a month. So you can take 1 pill and prevent so many problems with your cartilage because you're getting the nutrients that your cartilage needs, okay? Also, and remember, if you're acute, you can take 2 or 3 of the joint complex a day. But normally, you just take 1 a day if you're just trying to prevent joint problems, okay? And then additionally, you can also add resveratrol for joints complex, ginger root, apple cider vinegar. All those are natural anti-inflammatory properties. What we don't want to do is take over-the-counter medications because those create other problems that are even worse than joint problems, okay? So we should all be feeding our joints with a good, healthy diet. We should all be taking some joint supplements because remember, our joints are very important. We lose our joints, we lose our mobility, and then we can't exercise, and then we go downhill fast, okay? And remember, when you have an acute joint, okay, so you have a lot of pain, it's in your knee, it's in your back, wherever it is, you want to get adjusted first. We have the new KLaser. KLaser is a most powerful laser out there, and it will help your body heal faster. It'll help the cartilage regenerate. So let's say you're acute, you tore the ligament in your knee, you tore the tendon somewhere, you pulled a muscle. The laser is very, very fast as far as healing things, especially avascular things like tendons and cartilage and ligaments. The laser is incredible. It's not good for chronic conditions, but it's very good if you have a fresh injury. If you tore something, that's when you want to use the laser. And then decompression is really effective if you have a acute low back issue. So if your back, you just flared up your back, then decompression laser combination will be good for that as well. Okay. So in the old days, we used to believe that there's nothing we can do. Oh, arthritis is just a normal part of aging. There's nothing I can do about it. My father had it. I'm going to get it. No. Arthritis is not a normal aging process. It's only a result of being out of alignment and being active. You make sure you stay under chiropractic care, spinal engineering care for the rest of your life. You won't have to worry about it. Also, when you're a phase 1 or phase 2 or even a phase 3, we take post x-rays every day and we see how that x-ray has improved. We see how that disc space has regenerated and restored its thickness. We had a lady in her 70s that grew 2 inches just because her posture improved and her disc height regenerated. How does that happen? Because we get under care, we stop doing the things that were making it worse. She used to do power walking every day. We stopped that until we got her x-rays back in alignment. She went to low impact exercise like the elliptical. And then once we got everything back in alignment, she started her walking again. But even now, even though her x-rays corrected, she only power walks every other day now instead of every day. So we stopped doing the things that were making it worse because we didn't know it was bad to do power walking every day. We didn't know it was bad to do golf and tennis every day. We didn't know it was bad to run every day. So we stopped doing those things. We cut out the bad processed foods, especially the soda pops. And then we replace that with the good healthy food and the great supplements we just talked about. And we watch that disc and cartilage regenerate. And they don't say this. The medical profession says, oh, once you get degenerative disc disease, you've got it forever. We've been doing this for almost 26 years now. And we have thousands of x-rays where you can see that the cartilage has increased in size. So the degenerative disc is now back to a normal height disc. We see it all the time on post x-rays. So this works. We're ahead of our time on it because we're spinal reengineering chiropractors. Most chiropractors and medical doctors are only treating symptoms. They're not correcting the structure. We're applying the first law of engineering that says proper structure is proper function. So once we change your structure, not only do we improve your joint orthokinematics, we improve the spine, we improve your nervous system, we improve your overall health. Your immune system's stronger. You're able to exercise without pain. Your life is in a much better position, okay? So arthritis is not a normal aging process. It's only a process of being out of alignment and being active. And remember, most people don't realize they have arthritis because you have to compress 90% of the nerve to feel it. They don't know they're out of alignment because they adapted with poor posture. So we're never going to judge our joints by how we feel. We're always going to judge our joints by our orthokinematic assessment. So we're going to get a yearly assessment on all our joints, minimum once a year. And remember, the 6 essentials is what we do for everything. We make sure we start our day with 15 minutes a day of prayer, meditation, Bible study. We make sure we get our adjustments weekly until our x-rays are corrected, that we practice good posture, that we don't sleep on our stomachs anymore, right? We make sure we're eating good foods that God made, not man's processed foods, at least 75% close to the vine. Then we make sure we do our exercise. We want to do 12 minutes of exercise 6 days a week, okay? And then we want to make sure that at least 2 or 3 days a week of that's high intensity interval training. Then we want to make sure we're resting in alignment. Make sure that we're sleeping on our back. We got the contour pillow, the roll under our neck. We got a roll under our low back. And then we got a pillow under our knees. And we're on our back the entire night. We don't want to be flipping and flopping. We want to stay on our back the whole night. And the worst place to be in is your stomach. And you want to be able to wake up naturally without the alarm clock. Okay? If you woke up with the alarm clock, you didn't get enough sleep. And then the last thing is we want to make sure that we do a detox. We all have toxins. We have toxic thought. We have toxins in the air, toxins in our food. We're going to do a detox every 6 months until we get the toxins out of our body. So make sure you get information on that. But we start our detox by doing a 2 glasses of purified water first thing in the morning to flush the toxins out of the kidneys as well as the bladder. Okay? And remember this, Dr. Chestnut and many other doctors have proven this, that all sickness and disease can only come from 2 things, deficiencies and toxicities. Okay, that's it. And once we take care of those, and the most common deficiency, decreased nerve flow coming from subluxations you adapted to with poor posture. Okay? And the most common toxin is side effects of medications that we're taking for things that we used to feel. And of course, our poor diet, okay? So that's why we need to make sure that we get everyone checked for subluxation, because you could be out of alignment and not even know it. So if you watch this video and you're a potential new patient, or you want to forward this to someone that wants to be a new patient, you forward them this video, they watch this video, and then they get their first adjustment and exam for only $47. Normally it's $525. And also, if you guys need us to come speak at your company, your civic group, your church, we bring lunch, we come. So many people don't know what you guys just learned. This information is common sense, and everybody should know it. But unfortunately, nobody knows it because there's no money in fixing problems. All the money is in treating symptoms. And we've got to stop that type of thinking. We've got to look deeper to the cause of the problem. We've got to take care of our bodies as if it was a temple from God. And most of us are taking better care of our car than we are our own body. And we've got to stop that. We've got to get back on track. So thank you guys for listening to our joint health class. And remember, feed your joints healthy food, take good supplements, and get your adjustments for the rest of your life. Thank you so much.